Okay, so do you remember what? Oh, you were talking about you were
Yeah,
17 years
70
old
years is
and
coming for holidays after from high school. So we actually met with my dad being taken to hospital. At the gate, like it was like a high. And that was, I think it's never stopped bothering me that one, I didn't know that he was sick, but also that he was so frail, and that had all happened in 1 month. And considering he was a nurse, okay, at least a nurse practitioner in those days, and that was the last time I saw him alive, basically, unfortunately. And later on, when I got to know the processes, that it was mostly due to inefficiency in our healthcare system, because it'd been managed for pneumonia, managed for TB, managed for malaria, all the wrong things, and no one had really taken time to just take a good history or even just examine him, then they would have other suspicions. So I think from then, though it hurt, it stirred up something in me to actually want to pursue medicine. So that I would not want anyone else's father to be in a similar position if I'm able to help it. Yeah.
that's good. Thank you for sharing that.
Okay.
Um, oh, so you had said that you're from Western Uganda.
So I'm at the border, actually, at the border
Oh,
of
okay.
Kenya and Uganda.
Oh, okay.
Yes. Mm.
So is there a need? Is that a rural area? Is there a need for doctors and surgeons?
So the whole county, actually, that I come from, of the 47 counties in Kenya, it's one of the, I would say, it's a whole village. It's just basically a rural setup, the whole place, with very small towns. And there was only one general surgeon that I knew about in the county hospital who died, or rather I would say one good general surgeon, because the practice has been for those that we would hear are in the county hospital. They're not actually there. They are there on paper, but they are practicing in their private facilities. So, and that is the notion I also had when I was in my undergraduate. And that is also one of those things that I noticed when I came here for internship, that this is different. Why are these consultants not going anywhere else? That they're just practicing in this facility. So that made me think about practicing medicine or surgery a bit differently from what I'd seen before. Yeah.
Could you, just to confirm, say that I'm from a rural area
Okay.
in Western
Okay.
Kenya where uh, are we don't have access
Okay, sure.
to healthcare.
All right. So I reside in a rural setting in one of the villages in Kenya, where medical practice is basically almost non-existent. So we are struggling with practitioners, we are struggling getting surgeons and even other medical practitioners. And so healthcare is basically really hard from where I come from. Yeah.
That's perfect. Um, is there a story, um, a patient story that you remember that had an impact on you since you've been a resident?
There are many. Let me, if I'm able to point to, hmm, so I would consider, okay, there are a few scenarios I can remember, maybe not entirely in the entirety of their stories, but maybe the things that stand out, especially in view of the setup we are in, because this is also a rural setup. So there have been patients who come, and this being a mission hospital, we thank God that the administration does not really bar people simply because they don't have money. So there was this, I don't remember, he was a child, I don't remember the exact age, who would come in with abdominal symptoms suggestive of intestinal obstruction. And because they don't have money per se. They didn't have money at that time. We were able to do lab works and investigations in addition to the clerkship, and ascertain that she had worms that were causing obstruction and that were not able to be managed conservatively. So we took her in, and we were able to remove the worms. But because she'd come in pretty late, so she was sick for a while. She required some ICU care for a while. And then even in the ward, she didn't go to our ward once. She went, I think, 3 times because of further complications, because of the malnourishment she had before theater. And even the things that we were trying to sort in terms of electrolyte abnormalities. But I remember that because this was a single mother with a child, and this was not the only child, there were other children. So the whole bill eventually, I think, was waived by the hospital, and I thank God for that again for this facility. But it was very, for me, that the mother went home with a child who is alive, who was not supposed to be alive, and that she did not bear the burden of having to look for money. That really touched my heart. And I pray to God that I would be in a position to do that for the entirety of my life, in such a position. Yeah.
That's great to hear. Thank you for sharing that. What has been one of the biggest challenges that you've faced as a resident?
So just mentioning one would be hard because there are many. One, residency itself is tough. So being able to juggle between the hospital work, studying, and then as I have been coming up the ranks, even now, if I say this year, as the chief, being able to also manage now the rest of the team has been really tough. In addition to I'm still having the responsibility over my own family. Not necessarily nuclear because I've not started the family yet, but my mother and my siblings. So that has been really heavy and sometimes even overwhelming. Yeah, so it would be difficult to point out one because all of them are just working together. But I thank God that we are here. Yes.
That's great. Now, PAACS is a unique combination of not only medical training, but spiritual discipleship. Can you talk about that?
So as I mentioned, I think mine started in internship, basically. And then now when I started my residency in 2021, the 3 faculty that we had have, because this was basically, I was the second in this program, so in the second year. So basically we were starting off. And I found a system where, apart from just managing the patients, surgically speaking, there was also we have Bible studies. We have sessions where even the interaction with patients, no one hurries me when I am speaking with a patient. And let's say I have a patient who's terminal, and I can take all the time, let's say in clinic, and speak to them and speak with the relatives because I have seen my consultants do the same. Because I've been taught wholesome management of patients. And more importantly, the fact that whatever happens is psychologically or mentally, and even the spirituality of the patient really, really has so much to do with how the outcome, even in the surgical problem they had. So I have learned a lot from my faculty. But even in the setup of this mission hospital, I think everyone is sort of oriented to to present Christ in the way we manage our patients, so much that it becomes a norm. You don't even know that you are doing it. You just get used to it right from the beginning. And for that, I'm very grateful. Yeah.
That's great. Good to hear. How has what is your vision after graduation? What's your vision? Are you planning to go back to Western Uganda? Or not Uganda,
No,
Western
Kenya.
Kenya.
So
Sorry.
that is one place I have been asking God, what should I do? Because I would love to be in such a setting also, if I'm able to get a mission facility to be able to serve, because I've been to in external rotations in Tenwek and Sodo, and especially the Sodo setting, and I saw how that setting, apart from my own setting, people that are served are those that actually really require the help. And if I'm able to be in a position where there is such a facility, because sometimes going to the public facility, you want to serve, but you have nothing to serve with. So I am praying to God that He will make a way for me to get, if possible, a mission facility to work with, because that would be awesome. But even if He does not, I believe that wherever He sends me, things will work out. I pray that even if it is a public facility, that even if it is just changing one person, that might be it for me, if that is what He wants from me. As of now, I've not really had any concrete plans as of yet about where I'm going. So I'm still trusting God that He will show me where He wants me to go. Yeah.
That's good to hear. Um, what would you say to other young doctors that are interested in the PAACS program?
So the PAACS program is very unique. And any Christian doctor who is surgically oriented, or rather would want something to do with surgery as their subspecialty, if they are able and willing, then I would recommend them to join a PAACS program in whichever country they are in, where there are PAACS programs, because this nurtures you wholesomely. You come out as a doctor, but with a different mindset. You come out as surgeon, but with a different, the way you look at patients. You don't see money. You don't see them as source of your income, as in other places, because we have colleagues in the other side too. And you see even their perspectives are different. When you look at a human being as a human being, and that if God gives you the opportunity to be able to serve, that you would serve the human being the way you would want to be served. So I think PAACS programs have this unique gift that they're able to teach you. And for 5 years, if this is inculcated in you, you would not even notice that you have changed, even if you came in not knowing if that was not what you're doing before. So I would recommend this to any doctor who would want to be a surgeon that loves the Lord and a surgeon that works for God. This is the best place for you.
That's great.
Yeah.
How would you say thank you to the supporters of PAACS who are making this program possible?
Sometimes when I sit down and I pray, I want to know these people, because they have been such a blessing to us. And now let me be specific to myself. You have turned this poor orphan, I would say, into a doctor, because in 1 month I will be a general surgeon. And for that I am very grateful. You have changed not just this life, but the life of people that God is going to use me to touch. And I pray that in all things that God will bless you in everything that you do, and that if possible you will continue supporting others.
Yeah, that's great. That was perfect.
Thank you.
Is there anything else you would like to add?
Not necessarily.
Okay.
Yeah.
Yeah, I can't think of anything else.
Okay.
No. Okay.
Awesome.